1A lactating mother came to the family planning clinic seeking contraception for the first time. The nurse discussed about contraception options, the benefits and side effects. But the mother was confused to decide the type of contraception she wants to use. What is the priority counseling approach to be applied in this condition? A. Keep two-way communication. B. Remain non-judgmental. C. Ensure privacy. D. Show empathy. Answer. D. When helping a mother navigate her contraceptive choices, it's crucial to create a supportive and comfortable environment. While all these approaches are important, the priority should be to show empathy. D. This means actively listening to her concerns, understanding her situation, and making her feel supported throughout the decision-making process. When she feels understood, she's more likely to trust the guidance given and make a decision that's right for her. 2. A 6-month lactating mother came to the health center for family planning service. After assessing her eligibility and providing counseling, the nurse inserted Jadel in September 2012 EC. Before the mother left the clinic, the nurse gave her a reminder card for a return visit for removal purposes. What would be the most appropriate appointment date for the next visit? A. September 2014. B. September 2015. C. September 2016. D. September 2017. Answer -D. Jadel implants are effective for 5 years. If the implant was inserted in September 2012 EC, the most appropriate time for removal would be in September 2017 EC. So the correct answer is D. September 2017. 3A mother who uses an implant contraceptive came with complaints of changed bleeding pattern, headaches, abdominal pain, breast tenderness, and nausea. The mother reported that her menstruation period becomes sometimes absent and little in amount on other time. What is the priority intervention for this woman? A. Switch contraception. B. Provide counseling. C. Check for pregnancy. D. Remove the contraception. X. Answer. D. The priority intervention should be to check for pregnancy. Option C. Given the symptoms of changed bleeding patterns and other side effects, it's important to rule out pregnancy before considering any changes to her contraceptive method or providing further counseling. 4. A 25-year-old mother came with complaints of excessive and irregular monthly bleeding after 6 months of taking contraception. She also complains about increments of her weight. Her body mass index was 26.4 and blood pressure 140/80 millimeters of mercury. The nurse counsels her to shift the contraceptive she uses. What is the priority side effect of the contraception? A. Weight gain. B. Excessive bleeding. C. Irregular bleeding. D. Increased blood pressure. Answer. B. The key here is that the nurse advised her to switch contraception primarily because of the excessive and irregular monthly bleeding, which can significantly impact her health and daily life. Therefore, excessive bleeding, B, is the priority side effect because it poses a more immediate and disruptive impact on the mother's health and daily life, prompting the nurse to recommend a change in contraception. Once the bleeding is managed, other symptoms can be more effectively evaluated and addressed. 5. A 31-year-old woman came to gynecologic unit with complaints of lower abdominal pain, pain during coitus, abnormal vaginal discharge, and fever. On physical examination, the nurse found uterine and adnexal tenderness. What is the most likely confirmatory manifestation for this patient? A. Pain during coitus. B. Lower abdominal pain. C. Abnormal vaginal discharge. D. Uterine and adnexal tenderness. Answer. D. In this scenario, the most likely confirmatory manifestation for the patient, who presents with signs suggestive of pelvic inflammatory disease, PID, would be D. Uterine and adnexal tenderness. This physical examination finding is significant in diagnosing PID and indicates inflammation of the reproductive organs. 6A woman came to a gynecologic OPD with complaints of excessive and irregular uterine bleeding. The woman cannot remember when her menstrual period started. The amount and duration of bleeding also vary during each cycle. What is the most likely explanation of this finding? A. Menorrhagia. B. Metrorrhagia. C. Polymenorrhea. D. Menometrorrhagia. Answer. D. The most likely explanation for excessive and irregular uterine bleeding with varying amounts and durations is D. Menometrorrhagia. This term describes both heavy, menorrhagia, and irregular, metrorrhagia, bleeding, fitting the description of her symptoms closely. 7. An adolescent girl came with complaints of difficulty and pain during sexual intercourse. She has regular menstrual period with abdominal cramps. On pelvic examination, a nurse identified looses of hymen membrane and a membrane-like structure with small perforation on middle third of vagina. The nurse suspected that her problem is vaginal congenital anomalies. What is the most likely manifestation for diagnosis of this condition? A. Abdominal cramp. B. Small perforation. C. Painful sexual intercourse. D. Membrane-like structure. Answer. D. The most likely manifestation for diagnosing this condition is D. Membrane-like structure. This specific physical finding indicates a congenital anomaly, which aligns with the nurse's suspicion. Pain during intercourse is a symptom, but the membrane-like structure is the key diagnostic clue here. 8. A 20 weeks pregnant woman came with the complaint of vaginal bleeding for 3 hours. She had abdominal and back pain. On examination, her hemoglobin level was 9 grams per deciliter, normal range 10.5 to 13.7 grams per deciliter, blood pressure 90/50 millimeters of mercury, and pulse rate 110 per minute. The woman was diagnosed for inevitable abortion. What is the priority nursing intervention for this woman? A. Provide analgesia. B. Reassure the woman, prepare for blood transfusion. D. Resuscitate with normal saline. Answer D. The priority nursing intervention in this situation is to resuscitate with normal saline D. The patient's low blood pressure and rapid pulse rate suggest she is experiencing hypovolemic shock due to blood loss. Fluid resuscitation with normal saline is crucial to stabilize her hemodynamic status before addressing other concerns like blood transfusion or pain management. We need to first stabilize her vitals. 9th. A 35-year-old multi-para mother came with complaint of protrusion of mass on her vagina. She had also sense of pelvic pressure, backache, and fatigue. After assessment, she was diagnosed for uterine prolapse. The uterus is repositioned by gynecologists. What is the priority intervention for this mother? A. Resuscitate the woman. B. Administer pain inhibitors. C. Educate about pelvic exercises. D. Teach how to control urine incontinence. Answer C. If the woman were exhibiting signs of hemodynamic instability, like low blood pressure or rapid heart rate, after the repositioning, then resuscitation would indeed be a priority. However, since those acute signs are not mentioned in this scenario, focusing on education about pelvic exercises becomes more relevant for her long-term recovery and prevention of future issues. However, the priority intervention for this mother is to educate about pelvic exercises. C. These exercises, particularly Kegel exercises, can help strengthen the pelvic floor muscles, which is crucial in managing and preventing further prolapse. Pain management and addressing urinary incontinence are important, but empowering her with exercises addresses the root cause and helps prevent recurrence. 10. A nurse was providing care for a girl with abnormal excessive uterine bleeding, breast tenderness, anorexia, and vomiting. After 24 hours of care, her blood pressure became to 110/70 millimeters of mercury, pulse rate 76 per minute, respiratory rate 22 per minute, to 37.8 degrees Celsius and hemoglobin level 9 grams per deciliter. Which finding shows effectiveness of the patient's management? A. Blood pressure. B. Body temperature. C. Hemoglobin level. D. Respiration rate. Answer A. Blood pressure. A, stands out as the most telling indicator of effective management. Stabilizing blood pressure is crucial in acute care, reflecting an improvement in the overall circulatory status. The other vital signs and hemoglobin levels are important, but blood pressure normalization speaks volumes about her improved condition.